So I am very, very, very hopeful that we will have 40 of you guys being a PMHNP board certified in the next few weeks. If you started the course on module 3 immediately, it's okay. So we'll do module 4 next week, followed by module 5, crash course review, and then we'll start off on module 1 again and 2. And by then, you would have finished your entire sequence of the modules. Also, make sure that you are doing your question bank, right? There are maybe 150 to 200 questions per each module, give or take. In total, there are about 1,400 questions between the two modules, the two question banks. So you can definitely learn a lot from the question bank. So make sure that you are finishing your module, doing your question bank, downloading your PDFs, studying the PDFs, really getting into it. You only have to do this for a few weeks. After that, you'll be a PMHNP board certified. I promise you. Just study hard. Study hard for these few weeks. Set a date. The test gets real when you set a date. Set a date and go get it what is yours. Okay. Any questions before we get started? Okay. So I am going to share the screen and we can get started with today's event.
I don't think we have the code yet, do we? Or
Now I'm gonna about to share the
oh,
screen
I'm
and
sorry.
yeah, it's okay. It's okay. And I'll give you the code. See if this is the right screen. Okay. So if you have not played Kahoot, let me know. I'll show you how to. In the beginning, it can be a little bit difficult, but one of the easiest way is for you to use your phone and take a picture of the QR code on the screen. Then select a nickname and you are in. Remember to use your phone to answer the question. So the winner gets $100 today. Just the winner. It's not many of you guys today. How many we are in? So let's see how many folks we have here. Make sure that if you win, can't see because I have something right in between. Yeah. Make sure if you win today, you send me an email. You can use that towards the PMHNP psychopharmacology course, which is a very, very in-depth medication course, right? That you should immediately after passing the board, you should log into this course, take advantage of it because it's a complete review of everything you have learned throughout your school years and more, much more. Lots of clinical pearls. Um, yeah. Any any questions on modules 1, 2, or 3 that we've been covering for the past 3 weeks or so?
Dr. Lopez, I had plans with my family yesterday and wasn't able to attend. I
I
attended both
know.
1 and 2. So I'm assuming it'll be maybe a week or two before what was recorded yesterday is available, or?
Yes, actually, I'm planning on decoding and have to shrink and doing all this
Right.
today. So I would think 24 hours from now will be available.
Okay. I'll have to watch it another day.
Yes.
I wasn't able to. I had a lot of family in town and we all got together yesterday. So, but
Yeah.
I'll
Yeah.
watch it when it's posted. Thank you very much.
Yeah. Absolutely. But remember that the entire program is also available on pre-recorded mode. But if you like the live one, they'll be available in 24 hours.
Okay.
And yeah, I
Thank you.
noticed that you're not there. So I was like wondering
Oh,
where
thank
have you?
you. Yeah, I was trying to do this with my family like this Sunday, but not everybody could coordinate their schedules, so it ended up
No,
being Friday, so that's what we did.
yeah, no, it's got to take time for family for sure.
Yeah, yeah. All right, thank you.
Absolutely. All right. Is anybody not able to log in at this moment? Okay. So if you just logged in, go ahead and take your QR code. Use the QR code to log yourself in. Pick a nickname, and we're about to get started. Okay. Going to write it down the code here because some people will ask me about the code and they will not know what is the code uh, for this session. All right, we're giving 2 minutes here and we'll be getting started very, very soon. Guys, I cannot say this enough, right? Um, the PMHNP board certification is likely to be the most important test of your entire life, but it's very doable, right? You have the entire program at your fingertips. You have our WhatsApp group that will help you with any last minute question. You have the crash course review. You have the question bank. When that's all done, you have your diagnostic test that pinpoint if you are ready to pass on your first trial, right? All you have to do is score 80%, and it's like a sure thing that you will pass. Obviously, you have to put the work. There is no magic bullet, but we can make it this a lot easier. If you follow the plan, start it daily, follow the plan, start it daily, put some effort into it, you will pass, right? Think about it. You only have to do this for a few weeks and you will never have to do it again. So I would highly, highly advise to set a schedule. Um, I would highly advise to share a schedule, maybe an hour and a half per day for a few weeks, 4 or 5 weeks, and that's it. You don't have to take the entire day studying. The PDFs are pretty handy, very easy to follow along. So that way you listen once to the videos and then after that just work with the PDFs. Okay. This week we had a lot of people that passed the board. So congratulations to all the students that passed. You guys actually did it. So, all right, we are about to get started. If there is no further questions, we are beginning now. 1, 2, 3. Good luck, everyone. Lots of domain 5 today. Some are not from domain 5, but we have some questions there for you. So it's asking for the priority or the initial action that you should take. Look for an umbrella answer. All right, very good. So this is actually a tricky question, right? Because the red one is not necessarily wrong, but is it the most complete question? Okay, so admitting the patient is a possibility, but what would be best? Developing a safety plan and the patient agreeing on the admission process, right? It's a more complete answer. Lots of time on the board, you will find those questions in which one is good, the other one is better. Okay, so we do have a question. Let's answer the question. Go ahead. Is that someone has a question there? Nope. Okay, so moving on. So it's not that admitting the patient is incorrect, but if you can't develop a safety plan with the patient and have the person understand that admission would be the best for him or her at that time, you are combining a good treatment and patient agreeing with it instead of immediate involuntary hospitalization. Okay, it's just a better answer with the safety planning. Remember, sometimes I'm not able to put a full answer in one of the answer choices. I have to shrink it. Yahoo doesn't allow me to. All right, so this one, it was easy peasy, right? Let's see the green option here. Suggest an alternative non-pharmacological intervention to the patient. Well, that would could be an addition to, but you are authorized to prescribe medications for mental health conditions, right? So explain the patient that a PMHNP, they are qualified to prescribe medications for mental health condition, right? Any questions about this specific topic? All right, then we're moving on. Okay, very good. So yes, you are absolutely correct. Assess the patient for MET and, if appropriate, initiate treatment, right? So you can prescribe medication for substance abuse such as Suboxone, naltrexone, and just to name a few. But you have to assess if it's appropriate, right? As the PMHNP, they are not authorized to provide MAT would be an incorrect answer. You are, right? However, it'll be who of you to be trained on and knowing how to do so. And also depends on your state regulations. Some states may say that you are not, right? But nationally, according to the ANA, you are authorized to prescribe as long as you are trained on. Here's a question that's a little bit muddy waters, right? Not a very clear answer. Okay, all right. So I'm surprised that nobody picked the green option there, contacting law enforcement, right? You could have just passed the buck and say, well, I'm going to contact the police. So that's okay. And the second most popular option here was respect the patient's autonomy and provide outpatient treatment options, right? That would fall a little bit short of what we want to. Just respecting the patient's autonomy is a great thing to do, but informing the patient of the consequences of what could happen would be a better choice. And the red one, it says admit the patient involuntary for immediate stabilization. That's like from 0 to 100, right? Right away. But a more comprehensive answer would be explain the risks of refusing hospitalization. So you are educating of why hospitalization would be a great idea. If the patient continues to refuse, obviously you are always document and you are going to assess for safety. Basically, here when I'm saying assess for safety, then you would measure the safety level and take the next appropriate action. Right? So it's a more complete answer on a umbrella answer in this case. So Jeanette, Dell, Cog, Bella, and me, Might are taking the lead here today. So this is just a summary of what we just covered, right? Next question. All right, we got 5 seconds. Pick your best answer and go. 1, 4, 3, 2, 1, go. Okay, offer hospitalization referral due to the presence of suicide thoughts, right? Compared to, let's see, adjust the current medication regimen and continue outpatient treatment. But here is a settle different. It says offer hospitalization referral, right? So you're giving the patient the choice here, initiating hospitalization referral due to the presence of suicidal thoughts. This option addresses the patient's occasional thoughts of self-harm, which is a serious concern, right? So suicidal thoughts want an immediate attention and should be considered a priority. Hospitalization may be necessary to ensure the patient's safety and provide intensive therapeutic intervention. So hopefully, as we do more and more of those questions, it becomes a little bit easier to answer the next and the next question. We have a full question bank of over 1,400 questions available to you. All right, so you have someone that is not having a good outcome with the current medication. And the medication time, it was important because it said 6 months, right? So in this case, if you had a PHQ-9 of, let's say, 20, your immediate action here, if asked for the priority, would be just one: assess for safety risk. It didn't give you this option, right? But basically, it's saying she has thoughts here and there, but no plan specific. Discontinuing the medication would be an incorrect option, right? So nobody picked that. Great. So the green option here, start cognitive behavior therapy sessions to address her symptoms. It is a plus. It is a possibility, but therapy will take a little while, right? And what would be the best option really is to increase the current dose if she has not maxed out yet. Now, initiate immediate hospitalization due to suicidal thoughts. Not, we are not there yet. I always tell my patients that although it's not normal, but I think a lot of people have had suicidal thoughts at least once in their lives, right? So having the thoughts alone is not necessarily a must be admitted, right? So there is the thoughts proceeded by the plans. When we get to a plan, we are getting very, very serious. That's when I tell my patient, at that point, I don't want you to do anything else. I want to know. I want you to tell me. And that is the intent. So the thoughts, plan, and the intent is a sequence, right? So just having the thoughts is not necessarily an admission process. At this point, after having the thoughts every once in a while, it's okay to continue, possibly okay to continue outpatient, readjust the medication, and continue monitoring for safety. Think about if every patient that we had just a thought of suicide last week before, and comes to you and tell you that, how many patients you would have to admit? What if they say no? Still, would you admit them involuntarily because of the thoughts every now and then? No, right? We have to use the balance between our power, our education, and the patient's will and freedoms and reasons for safety. Anytime you hear safety planning, it's a great option. Never safety contract. Safety planning, yes. Safety contract, never. Okay. Okay, so this one's a little bit different, right? So this question, the patient has the thoughts, has the plan, has the means, and has the intent, right? Hopeless, his affect is flat. He already got the medications and just telling you as the last resort. At this time, initiating a safety plan is too far to the right here to come back and just trust that everything's going to be okay. At this time, we're too far in. We have to prioritize the patient safety. Immediately involuntary hospitalization would be an option. However, the first option would be an answer like discuss with the patient the possibility of admission, explaining the pros and cons of admission this times and the reasons why would be a more complete answer, right? If we don't have that, it would boils down to the patient needs to be admitted due to the high risk that the patient is presented at this time. Is that clear? Any concerns? Okay, let's do this. Actively suicidal, has a plan, and has access to means, right? This action ensure the patient's safety and a thorough assessment by a mental health professional is necessary. Right? Next question. Okay, so our job is to educate, right? So even though I absolutely want to respect the patient's will, I cannot, in good conscience, say, hey, John, I know you want to stop the medication, so let me go ahead and stop it for you. And don't say anything about the reasons to, that if the medication is stopped, what could possibly, I don't know, I don't have a crystal ball to know for 100% sure what could happen. A better option is, hey, John, I understand that you want to stop this medication. How about if we discuss the risks and benefits of doing so and work a plan collaboratively to ensure that you are well aware of your choices, right? So educating the patient would be a great answer here, right? Not to that say that if the patient wants to stop medication, he has all the rights to do so. But our job is that at least explain the pros and cons of that. Now, the green option, inform the patient that they must continue the medication is wrong, right? I cannot force him to do so. That would be illegal to do that. I can only advise. We are two, right? We are two to educate, advise, and empower the patients. We cannot force them, and we cannot just blindly accept any demands from the patient either. We have to be in the middle there by educating and providing choices. So therefore, the blue options discuss the risks and benefit with the patient collaboratively is the best answer. All right, you guys just nailed respect the patient confidentiality. So this is a confidentiality issue and do not inform the parents, right? So good job everyone there. You guys nailed this one, right? So respecting the patient's confidentialities and refraining from informing the patients unless there is a imminent risk of harm aligns with the ethical principle for the PMHNP. Um, Confidentiality is essential to building trust with the patient, especially if, I mean, in all occasions, really, but there are instances in which we must break confidentiality, right? So confidentiality is very important with adolescents because it builds trust. Okay. So keep a good eye on that. Ethical principles is something that you will see on the PMHNP board certification. It's very important that you just kind of know about it. It's very important that you know it in details because the quite easy topics, they'll find a way to make it a super hard question out of an easy topic. All right, a bit of a difficult question here, more so because of the way the answers were written. You have to understand that Kahoot only allows me a small amount of characters, right? So, but the dilemma here is respect the patient's autonomy and uh, involve her in the treatment decision would be the best option. But what I was trying to say here, the dilemma is one is respecting the autonomies, the adolescent autonomy of confidentiality, while involving her in the treatment decisions is in line with the ethical principles. But more so, the dilemma here is caring for the patient first, but also caring for the family, right? So if the patient really wishes to involve the parents, it would be the best scenario. But what if the patient says, I do not want? But the patient is 17, right? So that creates a dilemma for us as a healthcare provider. And that's what I was trying to convey here without disclosing the sensitive information without the patient's consent. That creates a bit of a dilemma because we're in the middle. Well, she's 17. She doesn't want me to say. The parents is pressuring me to say something. So I am in the middle. That's the dilemma. Okay. But respecting the patient confidentiality is a must. Okay. A very hard one, right? Very hard one. But this is autonomy. You have to respect the patient's autonomy, even if it's not congruent with your internal beliefs that the patient should get a better medication here, right? So the patient did not say at any moment that he was at risk for self-harm, right? So autonomy is the ethical principle that emphasizes the respect for the individual's right to make their own decision about their treatment, even if those decisions may not align with the healthcare provider's recommendation. In this case, the patient's refusal to change their medication should be respected to the extent that it does not pose an immediate danger to their safety. So, but I can see this being a hard question. Okay. You can say, well, but he's schizophrenic and he doesn't have the mental capacity to make decisions. The question never said that he was currently schizophrenic, has bouts of symptoms of, right? So don't read into the question immediately. Okay.
The long question. The question is done on the screen, only on the phone.
Oh,
Yeah, we can't see the question on.
oh, I don't know what happened there. Oh, I'm sorry. Sorry, guys. Here we go. Sorry, we're gonna have to. Yeah, let me know because I'm looking at a different screen and I don't always see it. Um, so can't discuss this one because most of you guys didn't see it, but it was about ethical courses of actions in situations in which engage the patient's willingness to disclose their information to the parents or not, right? Um, when there's not an immediate safety concern, you should consider at all possible, when all possible, to refrain from telling the parents. Okay. This one was a little bit tricky because it involved occasional suicide, self-harm. Okay. All right. I can see why the blue option sounds very appealing, right? Um, the orange option, so beneficence, the PMHNP should prioritize patients with severe mental health condition. That actually sounds pretty strong, right? But it's asking about more so like which ethical dilemma is it involved. It was about justice, right? There are 20 slots and 30 people that need the slots. How those slots, 20 slots, should be allocated, pretty much, right? Non-maleficent, the PMHNP should avoid action that might harm patients. That is a typical answer that you find in almost all questions. A true answer, but doesn't necessarily correlate to the question. That's a true statement, right? But doesn't necessarily answer this question here at hand. So let's take a look here on the rationale, right? So ethical principle of justice emphasize fairness and equity in resources allocation. In this situation where the resources are limited, such as an appointment's availability, the PMHNP should strive to distribute these resources fairly. So, and that is the best answer in this scenario. But as I said, beneficence and allocating to those with severe mental health, it did also sound pretty strong answer, but it was the second best answer. Okay. All right. Very good there. Let's take a look on the answer. Again, Kahoot doesn't allow me to put a full answer here, but we're looking at the ethical principle of justice again, emphasize fairness and equity in healthcare. It didn't allow me to put justice in there, but I was hoping that you could um, conclude this is where I was getting to. Okay, so let me clarify here one thing. Um, so the question asked about the patient's autonomy versus which other ethical principle, right? So two things here. When we have a question like that, we are looking for the other ethical principle, not autonomy. Autonomy was already said in a question that we are respecting. The balance between autonomy versus what. We're looking for the what here. And the here we're looking for two possible whats, non-maleficence and beneficence. So when you pose with a question that's non-maleficence, that means you preventing them from getting hold of the medication because it could be harmful. Beneficence, meaning that in this sense, you are giving them the medication because it would be helpful. So example here, non-maleficence would be withholding benzodiazepine to someone that has alcohol use disorder with history of suicidality or with the risks of a drug abuse. So there'll be non-maleficence that you are withholding that medication because of the history of the past and possible harmful effect. Beneficence for the same patient would be to prescribe naltrexone because it has shown to increase the days without alcohol, and even if the patient drinks alcohol, the effects of alcohol would not be as intense. Okay, so for that reason here, we're looking for the what, the other ethical principle, and the focus would be on promoting the patient's well-being using strategies. So the best answer is coming here next, a more complete answer. Benefit sense, which focus on promoting the patient's well-being. It is crucial ethical principle in this situation. The PMHNP should prioritize the patient's well-being while using strategies to engage the patients in a collaborative decision-making process regarding medications, ultimately aiming to provide effective treatment while respecting the patient's autonomy. Autonomy was already said in the question. It was looking, the question here is autonomy versus what? Okay. So if the answers were a little bit confusing, I get it. It's just Kahoot doesn't allow me to put a full answer in there, but hopefully it was understood to some of you guys. So given the situation, the ethical principle should be prioritizing responding the patient's request to discontinue the treatment. In this case, is autonomy, is asking for what it is, not versus other. The PMHP should respect the patient's decision to discontinue the therapy. Okay, so autonomy here again. Okay, so you are seeing a patient, telehealth, let's say in the state of Maryland. Okay, now the patient moved to California, and the patient says, "Hey, I still want to continue to see you," right? Um, but you're not physically in California, neither you are licensed in California. So your action here is to cease providing therapy to the patient immediately due to the lack of licensure, right? Recommend the patient to seek in-person care from a licensed provider in the state is an option, but that's not the case. The case is now whether it is telehealth versus face-to-face care, right? So he is kind of putting the, hey, you should see someone face-to-face. That's the problem. No, the problem is the licensure, right? Option green here, contact the patient state licensure to inquire about the temporary licensure. Don't think that would be effective, right? The state licensure cannot just receive your call and say, sure, you can, let me give you a temporary license, let me email it to you immediately, right? It is a process, it takes time, and everyone needs to apply for the license. And for that reason, the blue option would be the best. You don't have a license in California in this example, then therefore you should not provide um, care in California, right? Be careful. Sometimes answers, as I mentioned before, will be true, but ask yourself if the answer is really answering that question. In this in this example, telling the person to seek inpatient or face-to-face healthcare was not a dilemma. It was whether the person is allowed to seek care in the state or not. Okay. Okay. Licensure, the PMHNP should follow the new state regulation and decline care, right? All right, let's see who's we have Jean, third place. Mind, and first place is Janet. All right. Well done, everyone. Dell and Hyde. You guys did great. Uh, Keep on practice, keep on coming. Remember, we have over 1,400 questions available to you with our question bank at www.mpexamcoach.com. You should really practice those questions. As soon as you finish a module, uh, get on the questions bank and practice that module. Okay. So what we'll do now, we'll do a quick pause of, let me see, It is 7 p.m. Eastern Standard Time, so we'll be back at 7:10. We'll do a very quick review of what we learned on Module 3. It was more of a talking. We'll kind of zoom in because the class already passed, but I just want to make sure that everyone is tracking on what we covered and kind of refresh your memory from yesterday's event. I'll see you guys in 10 minutes. Bye-bye.